Mechanism of rifampicin in the inhibition of bacterial RNA synthesis. When we talk about rifampicin is not only an antibiotic that is used to treat or prevent tuberculosis, but it also used for other mycobacterial infections like leprosy, but more commonly, it's actually used to treat staph infection, especially device-related infection like prosthetic valve infected with staph aureus or staph epidermis. And RNA polymerase is enzyme that a multi-subunit enzyme that apply its activity in the catalyzation of the transcription process of RNA synthesized from a DNA template. For the pharmacokinetic and pharmacodynamic, when the patient takes rifampicin has duration less than or equal 24 hours, well absorbed, and can cross blood-brain barrier well, protein binding 80%, half-life elimination 3 to 4 hours, time to peak 2 to 4 hours, and excretion for feces 60 to 65%, and urine around 30%. Rifampicin is specific to prokaryotic RNA polymerase. It is not specific to eukaryotic RNA polymerase because for eukaryotic, RNA polymerase is lower binding affinity, which can lead to resistance of bacteria to rifampicin. Let's see how does it work. This is RNA polymerase. Coding stand, template stand, and RNA. For the mechanism, rifampicin can bind to the beta subunit of the prokaryotic RNA polymerase, and it holds the RNA polymerase and reduces its promoter clearance probability. Once the promoter is not clear, the abortive transcription can happen and short length of mRNA would be generated, which would not give rise to a functional protein, and that's how the bacteria would be dead.
So from the mechanism, the drug specific to prokaryotic RNA polymerase or bacteria, which make the drug can be antibiotic class and can treat tuberculosis because tuberculosis is prokaryotic bacteria. Which for the pharmacological treatment, to treat Mycobacterium tuberculosis, should use rifampicin with other antibiotic drug. Because rifampicin just only inhibit RNA synthesis. However, Mycobacterium tuberculosis may grow by other ways, such as improve stronger cell wall of bacteria. So we may prescribe rifampicin with isonic acid to treat tuberculosis. The use of isonic acid is to inhibit cell wall synthesis of bacteria. And the co-administration between two of these drugs can be more potent and shorter duration of treatment. The dosage regimen. The dose for adults to treat tuberculosis has two categories, which are lower than 50 kg and higher or equal 50 kg. If the patient has the weight less than 50 kg, use rifampicin 150 mg and isonic acid 100 mg per tablet. Use 3 tablets once daily. If the patient has the weight equal or higher than 50 kg, use rifampicin 300 mg and isonic acid 150 mg per tablet. Take 2 tablets once daily. For the contraindication of rifampicin, when patient gets rifampicin, it will cause contraindication with other drugs such as atazanavir, darunavir, praziquantel, and tipanavir. Because rifampicin is induced CYP3A4 mediated metabolism. so rifampicin has risk of antiviral failure. So it should manage by avoid administration together.